SCFE, or slipped capital femoral epiphysis, is a condition that causes the ball of the thigh bone to break and slowly slip out of place over time. In this video, we will review how SCFE happens and why immediate surgery is needed. The hip is made up of a ball, your femur, and a socket, your pelvis. They are kept in place by a strong set of ligaments called the joint capsule. Our bones need a steady supply of blood to live and grow. The ball of the femur has a unique and fragile blood supply. Blood vessels wrap around the back of the neck, travel over the growth plate, and enter into the top of the ball. These vessels sit in the periosteum, a thin layer of connective tissue that covers most of our bones. The bones in our arms and legs grow from special areas called the growth plates, which are made up of soft cartilage. As we grow, the growth plates slowly create new hard bone. In SCFE, however, the growth plate becomes weak and breaks, separating the ball from the rest of the femur. Over weeks to months, the ball slips out of place. This has several effects. First, SCFE causes significant pain and discomfort. As SCFE gets worse, pain and stiffness start growing in the groin, hip, or even the knee. Pain may not be severe at first, but steadily worsens until it is no longer bearable. Second, SCFE affects your child's ability to move. They may not be able to bear weight on the affected hip and may walk with a limp and have a lower range of motion. They may start to stand or walk with their leg turned outwards and have difficulty sitting in some positions. Third, SCFE affects the blood supply to the head of the femur. In mild to moderate SCFE, there is generally a lower risk that the blood supply will be affected. However, as SCFE becomes severe, the risk of the blood supply becoming pinched, blocked, or torn becomes higher. If the blood supply becomes blocked, the ball of the femur is at risk of dying. We don't yet know what causes SCFE. It is one of the most common conditions of the hip joint in teenagers. Risk factors include high weight, rapid growth, and can be related to endocrine problems. To confirm if your child has SCFE, we will take an X-ray of the hips. Sometimes an MRI may be needed. Regardless of severity, SCFE requires immediate surgery. Commonly, a short urgent surgery, called urgent fixation, is needed to place a screw into the ball of the femur. This stops the ball from slipping any further and protects the blood supply. Depending on the severity of your child's SCFE, we may recommend the modified Dunn procedure. In this surgery, the ball is carefully realigned into a more correct position. This realigns the hip joint and restores a more normal range of motion to the hip while protecting the blood supply. First, your child will go to sleep under general anesthesia. Next, an incision is made on the side of the hip. Next, a part of the outside end of the femur is removed and carefully folded back. This protects the muscle connections to the bone. Next, the joint capsule is opened. The periosteum is carefully rolled back, protecting the blood supply. Next, the femur is temporarily separated from the ball, and temporary metal pins are used to reposition the ball back onto the femur. And the whole femur is placed back into the socket. Larger, stronger screws are placed over the pins to keep the ball securely in place. The fragment on the outside of the femur is folded back down, and a final set of screws are added to keep it secured in place. Over time, the femur heals in its corrected shape, being able to bear weight again, and your child should have an improved range of hip motion. Your child won't be able to bear weight for 6 to 12 weeks following surgery. During this time, your child will begin physical therapy and coaching on lifestyle changes such as weight loss if necessary. For more information, click the link here, call us at this number, or visit our website by clicking the links below.